They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle, with Health Alliance, is always at the forefront to help you thrive.
Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
At HS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HS St. Anthony's Memorial Hospital.
With technology all but ruling our lives today, it's not surprising that we're seeing a bigger impact in healthcare. One example is virtual health, which uses technology to allow patients and providers to communicate remotely in real time. But exactly how does this work? To guide our discussion today, please welcome Rakesh Mehta, Director of Digital Health and Innovation, and Dr. Robert Good, Chief Medical Officer, Population Health, Health Alliance, and System Medical Management. Thank you so much for both of you joining me today.
Yeah, glad to be here.
Yeah, so we're here to talk about virtual health. Let's just give a definition of that and what it is.
So let me answer this from the perspective of our patients and the community members, right? So from their perspective, it's actually a technology-enabled service which allows them to get healthcare, also get healthcare-related education, and in general just interact with their physicians and their providers. And this is all from a distance. So this is when you're not physically in front of your physician and providers. So that's the key piece of this. The biggest value this brings is access to convenient care. So that is in fact one of the driving factors why this is becoming more and more popular nowadays. There are several modes of how this is done, and people generally think about this as being just real-time communication. But actually, real-time communication is one facet of this. We actually also have where you can actually take a picture of some skin rash and then transmit it. So that's called store and forward. There's also data being collected. So if you have a congestive heart failure or your lungs are weak or something, your physician may actually prescribe that a lot of this data be collected at home, and then they can analyze this data later on. And in terms of devices, you can actually do this on your cell phone, a smartphone. You can do this from tablets. You can actually do it from a personal computer and even kiosk. The last thing I do want to mention before I turn it over is in terms of emergencies and urgent things, please do not use virtual health. Please call 911, bleeding, chest pain, signs of stroke.
Right, so there's a place and time for this, and we're talking about when to use it, when not, what's available. So how would you like to add on to that, Dr. Good?
Well, you know, it's more than, I mean, our concept today is the patient who's remote, but it also might be a medical center like Carle communicating virtually with a rural hospital emergency department. So there's communication, or there's information being driven that way. There's all sorts of ways that we can utilize virtual health. To the home health nurse that's in the periphery trying to care for somebody in rural Illinois, to the case management folks who are trying to make communications daily with their patients in a virtual way. So we have a lot of ground to cover in the many counties that we have in downstate Illinois. There's limited resources, and this is one great way of connecting that relationship with our patients.
Yeah, it sounds wonderful. It's so neat to see technology coming into play with things like this. How are patients reacting to this new type of medicine, I guess you would say?
Well, for those who have used it, they like it.
Mm-hmm.
For those who haven't, you know, it's changed. It's a little bit different. Rakesh, you may have some other experiences with that. But
And no, that's a perfect answer. I think also we've seen, surprisingly, and there's a common myth that our senior citizens don't use this technology, which is actually not true. So once they get trained on how to use this, they are pretty comfortable using this. So if you've used FaceTime, things like those, if you use a WhatsApp chat application, it's pretty much akin to that, but it is HIPAA compliant. What we mean by HIPAA compliant is there are specific things that in healthcare you're not supposed to store or transmit. So these technologies actually take care of that. But apart from that, we see moms, the chief medical officer of the house actually, they take care of babies or kids, and a significant section of they can actually use these technologies. Others are millennials. They're pretty savvy with all sorts of technology. We also see a lot of chronic disease patients using some of this technology. In terms of what, I think that's important to understand. I will say there are 50 or so conditions. So when you're using this from home, make sure you're aware of what conditions you can treat. So very simple conditions like pink eye or acne, rash, you have a fever. In the flu season, you don't want to get infected by sitting in outpatient departments. Things like sore throat. So these are the typical conditions. So be very cognizant and aware of what conditions you can actually see for using virtual. Another thing is chronic disease management. And one more thing I do want to mention is behavioral health. So there's a national crisis for behavioral health, and we don't have enough providers. So check with your insurance if that is provided through your insurance, and virtual is a good way of doing that.
Okay, let's just describe a little bit about how this works. So does somebody meet a doctor from their living room if they have the capabilities through the tools, maybe what the training is, what they need to be able to do this, and sort of just how it actually works?
I think you can. I mean, depending again on the situation, you could be in your living room. You could be, actually we have some couple interesting examples. Somebody was at their farm in this season, and they had some problems, medical problems, and they actually were on the farm, and they actually did a virtual consult, and the physician could see them, prescribe medication, and this was a board certified physician, which is available 24/7. And the wife could actually, his wife could actually pick up the medication in the evening. So this was all done on a farm. So actually another example is during the polar vortex this last winter, actually somebody used this and they were pretty happy about this. So you could be on vacation, you could be in a location that has very few family physicians or primary care practitioners, and some of the social issues. You could have transportation issues. So all these are very good examples of where actually virtual makes a good case.
So from an extension of that, you know, I've had patients call me in the middle of the night and they're out in the middle of a snowstorm here in Illinois. We just simply get on FaceTime and let me see what it is that is causing trouble. It gives confidence to them, gives confidence to me because I can see, and it's better than talking on a telephone. So there's a real benefit.
So is it a direct access line to a physician? Is there scheduled appointments?
This can all work in various ways. So it can be, as I describe, an urgency in the middle of the night. It can also be, I see in the future the day is going to come where I'm going to set up appointments virtually, and patients will be in their home. We're doing that now with behavioral health because we have a severe shortage of psychologists and psychiatrists in rural Illinois. Where we can, the patients in their home and they're communicating with their psychologist right through the telehealth system. We also have the ability for our specialists up north in Champaign to communicate directly with physicians and with patients that come to a remote clinic. So that's another aspect of this.
Yeah, it's neat meeting patients' needs through this technology and working ways around the obstacles that, transportation, weather, different things like that. So really neat. So is this something that can be used for primary care and specialty care?
Sure. Absolutely, yeah. This is all about adding value to what we do. So much of what we do in healthcare does not add real value to what is happening with our patients. So value is kind of described as, is it affordable? Can we afford it? Does it give us access? Is the patient experience good? Is the physician's experience good? And if you can meet those things in a quality fashion, voila, you get the pie of access and value. And that's what we're trying to achieve through another option of healthcare.
Yeah, sounds good. I see some different things out here on the desk. Are
Yes.
these some of the tools that you use?
Exactly. So I'm the digital guy, and technology has actually come a long ways. So what I have here, this is actually, and let me explain the use case. So as Dr. Good mentioned, you could be in your primary care practitioner's office, or you could be in a community health center, and you need a specialty access. So a specialist could be sitting in main hospital somewhere else. So what we use is called a telemedicine cart, and this cart essentially is a computer on wheels. It has a monitor whereby the patient can actually see the physician who is not in front of them. And the physician has access to specialized software. They could be in their offices, and they actually can control the camera, which is on the cart. So they can actually make the patient walk, and they can track the patient's gait using the camera. And some of these devices are actually, and I'm not going to turn them on, but you can actually take skin images. You have other extensions that can, that can allow you to see inside the throat, ears. And some of these devices are actually, and this is a digital stethoscope, so you can actually listen to the patient's heart sounds from a distance. And actually, there are some consumer-grade devices also, and that's actually available now at Best Buy. You can have them at home. Let's say you have 2 or 3 kids, and you can actually remotely examine the child at home. And so technology is coming a long ways.
So these types of tools would be in the hands of the patients?
So this particular set, no. This
Okay.
would be, so you would have a nurse actually presenting the
Okay.
patient in the community hospital. But the other device, which is consumer facing, yes, you could actually use them at home by a mom or a spouse.
Okay.
You can also hook up to this skin device, a computer which can analyze the mole, the skin lesion. Is this a melanoma? What's the probability of that? And communicate that type of information. Artificial intelligence is another component to this that kind of extends beyond what the physician may see. And so it's another little piece of what this type of virtual healthcare can deliver.
Yeah. Are there any obstacles that a person may need to overcome as far as do they need internet access, Wi-Fi capabilities, anything like that in their home if they're going to be utilizing this type of technology?
Go ahead.
Actually, yes. But you don't need very high bandwidths for some of these basic capabilities. And where we want to engage with the patient and collect data, whether it's blood pressure data or pulse data or on a scale, all these devices can actually, they actually come with a pod, as we call them, and these are cellular devices. So the patient actually doesn't need a Wi-Fi on their own. So if we provide a kit to the patient to monitor their data remotely, we actually also provide a cellular device which can actually collect all this data and transmit it to a cloud, as we call it. And then the physician can actually look, or the nurse navigator can look at all this data and look at the trends of the patient, and then call up the patient if the trend is in the wrong direction.
So there are some holes in all of this, and particularly when we get downstate, there are certain areas where Wi-Fi signals aren't all that great. Telephone lines aren't all that wonderful, and people may not have home equipment to hook up to the internet. So those are barriers to this. But that's getting fewer and fewer. And I've used this with hospice patients where the hospice nurse is in the home and I can remotely see the patient, they can see me and the family and so on. It works well as long as there's good internet connection.
Yeah, understandably. But it's good to get that information out for some people who may not know that this is available, some things to look into. And if you already have that, these are some options that we're getting information out to folks. Now, sometimes change can be stressful or difficult, and they may think, I just really want to see my physician or my specialty care physician in person. What are some things that you're helping decrease that stress and let patients know that this is something that can be really useful in their lives?
I don't think this is the only means of healthcare. This is a tool to improve access and the value of healthcare that we deliver. You don't necessarily have to see your physician or provider every single time. There's There's items that we can, or healthcare we can deliver by conversation without, I mean, really the only thing we can't transmit is touch. And we're working on that.
Yeah.
Okay. So I was involved with a graduate student at the University of Illinois where we were trying to transmit touch. And they had developed sensors in a glove, and then that would transmit the information back to me. The cool thing about that is that not only could I kind of feel what they were palpating, but I could also teach with that tool. So as we're teaching medical students and residents to palpate something, we can image what I can feel. And so it creates another little benefit to all this.
Yeah, absolutely.
I think to that point, I mean, not all conditions you absolutely have to see your own physician, and there are some models where we can actually allow that. We can ensure that if your physician is available and they want to get on that call, they could. From the stresses you mentioned, yes, there's always anxiety when you have new technologies and new ways of getting healthcare. And I would recommend check with your insurance, check with your healthcare organization. If virtual visits are available, then that's something you should try. One thing I do recommend is if you have children or somebody in your family or you yourself, if you're thinking of using this at some point, do some of that registration beforehand, because when you're in the midst of a child with fever or something, that's not the best time to be trying to enroll
That is
something.
stressful then, isn't
That
it?
is stressful, so that adds a little bit of that complexity, and you're thinking why this is taking so much time. The other thing is many of these things can actually be done over phone. So if you get lost in that registration process, there's a contact us, and there's a probably most of these services have a 1-800 number. You can call them, they can help you, and a physician can actually call you back. So there's things to avoid that stress.
Yeah, nice to know. Now, you mentioned something just a minute ago. You said this adds value, and I think that's one thing that you really want to get out to folks is the value that's added here, right?
Yeah, I mean, this is all part of population health. How do we manage and care for a population of people? And as a physician, I may have a panel of patients that I need to help manage, but together we're a community. How do we best care for a community of people? And when we're talking particularly rural Illinois, there is a shortage of healthcare providers. How do we do this? How do we manage all these chronic conditions and healthcare with the resources that we have? And this is one way, another tool to help in that process.
Yeah, that's something that I haven't heard spoke of a lot, of using the term population health. So that's exactly what you're getting at here, is trying to reach the population.
Right. We're trying to make the whole community better. Typically, it's not about the people we see. If a person goes to their physician and have a high confidence, they're going to be taken care of. It's about the people we don't see. And probably 2/3 of our population never seen by a healthcare provider in a year's time. So there's a great number of people out there that are, either trying to get access and can't, or have needs that aren't being met.
Okay. Did you want to add on to that?
Yeah, no, those are great points. It's also, when he spoke about community, I think some of these technologies allow for the patient and the patient family to see not just a physician, but you could be seeing a therapist, a social worker, somebody who needs diet advice. You could be seeing somebody who is talking about pharmacy issues, right? A lot of these senior citizens and others who have multiple chronic diseases, they are taking so many medications that it's very confusing. So you could have a pharmacist actually talk with them and say, okay, this is a duplicate medicine of this one, which is branded or generic, and how much that confusion can add to their complexity. And we want to make this about the patient. It's not about the disease. It's not about health care. So these technologies have a place. Not every single instance is going to be taken care of by these modalities. But there's a place for it, and if we can extend the scope of the physician and the physician's team, that's what we are looking for.
Okay. Well, speaking of that, what are some concrete things that people can do right now to look into accessing virtual health?
Well, one is having the conversation with your physician. Is it available? It's not available everywhere. It's an up-and-coming technology. As Rakesh and I have kind of investigated the various vendors that provide this, what's the best one to use? By the time we get done talking about one, and 2 weeks later a new one comes out. So technology is expanding rapidly, and what's the best choice for us to start with? we're really interested in doing some things also of value, and that is hospital readmissions. Trying to reduce somebody with a chronic disease who's been in the hospital multiple times and keeping up with them in their home, kind of being a hospital at home. So a person has a problem with heart failure, they go home. How do we best monitor them and initiate treatment in a timely fashion before they have to come back to the hospital again? And so this is a tool that we can use to monitor that through our healthcare nursing staff, through pharmacists, as he's mentioned. It's all about the team utilizing this tool to extend value to the people we help serve.
Yeah. Did you want to add on to that as well?
I just wanted to say, apart from that, if somebody is interested in virtual visits, which is more of the on-demand kind of a platform, then go to your carle.org website. It's carle.org/virtual-visits, and always talk to your physician. This all has to be physician directed. So I'll end with that.
All right. Now, what is coming in the future? You said that there's always new advances, new things coming out. What are some things that we haven't talked about that may be coming our way that we don't know about yet?
Yeah, so, the innovations of the future is what's really cool. And I think we established a Carle, Illinois College of Medicine this last year. Our first students just completed their first year. There are 32 students that are engineers, many of them with advanced degrees. And we hope as they start into their clinical time, they are thinking innovatively. How are we going to do things different in the future? How are we going to provide more access? Virtual health is one of those things. And how can they develop tools that will, with artificial intelligence, with various types of calculations to make what we do easier and better. So the day's coming when we're going to be getting some of this information and research and efforts to really get out there and serve the people in a different way. I don't predict they're going to be a bunch of Marcus Welbys, but I think what they produce and create will help Marcus Welby produce a better care for their patients.
Yeah, absolutely.
There's just a lot that we can do, and transmitting touch is just one of those examples.
Yeah, I can tell you're excited about it.
It's palpable,
you just
right?
see,
Yeah.
your eyes light up, and just hearing you be able to talk about these types of things and adding value to the patients' lives and helping their health care, I think is really has been informative today. And we have a couple of minutes left in the show. Is there anything that you would like to add that we haven't covered thus far?
We have like Dr. Good mentioned, we have a bunch of innovative applications and models coming up. And stay tuned. This will be on our website as things come up, and talk with your physician. So he's the best, or he or she is the best judge of these things, and they should be able to direct your care.
Okay. Anything else you'd like to add?
And again, I think talking about this and learning about it, and I think many people already have the ability in their cell phones to do a lot of this from a home environment, from laptops. It doesn't have to take huge technology. Even simple transmission things like Zoom or FaceTime can be used to communicate with healthcare providers.
Okay, let's give out that website one more time so people can hear that.
Absolutely, it's carle.org/virtual-visits.
All right, that sounds good. Well, thank you so much for
Thank
being
you,
on the
Kian.
show today.
Thank you, Kian.
Thank you. It's been very interesting to learn about this, and we hope that it has been informative for you as well. Thank you for tuning in, and we'll see you next week.
At HS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HS St. Anthony's Memorial Hospital.
Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle, with Health Alliance, is always at the forefront to help you thrive.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. the ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.